Well, I'm Jimmy McElligott. I'm Executive Medical Director for our Center for Telehealth at NUSC. We've been really excited about trying to get eConsults out there for our state. It's been a busy year for the team trying to get things out, but we just have a few providers who have really taken the plunge and started to use the tools and use eConsults. And we have with us Pate today. So that the team says you've been embracing some of the eConsults over this past year. So we'd love to hear from you. I really appreciate your time. My job is to moderate some of these questions and just dig some information out of you and get your opinions. And so the floor will be yours. I really appreciate it. The first thing I get to ask is just love to learn about yourself and your practice and just a bit of your background. That would be great.
Okay, great. Well, thanks, Dr. McElligott. My name's Pate. I'm a clinical associate professor with the University of South Carolina in the College of Nursing. And with that, they allow me to work at the Community Medical Clinic, which is a free medical clinic. It's not an FQHC, down in Camden, which is in Kershaw, South Carolina. So we provide primary care there for poor and underserved non-insured clients. So that's primarily what my duties are as a nurse practitioner. We also partner with NUSC, who's helped us kind of establish a school-based health center within our district as well. But I've been there about 7 years, been teaching with the college for about 8 years. Well, some of my nursing background is critical care. I did some inpatient ped psych and also done some hospice care. So I'm glad to be here. We really appreciate the eConsult program and have really enjoyed it. It's helped our clients tremendously.
That's awesome. Sounds like you're one of our South Carolina's innovative providers. We need more of. I love it. Tell me a little more about eConsults and how it benefits the practice and your vision for what eConsults will be within that practice setting.
So I think our setting may be unique from other providers that may be using it. Ours is definitely different because we have non-insured patients. A lot of them have social determinants of health that we have to actually address when we think about having a referral for our patients. So that may be transportation, it may be. Those are the two biggest things that really hinder our patients from actually getting the care that they need outside of what we can offer within the clinic. So when eConsults was first presented to us, it sounded very good. And as we began to learn more about the different specialties that you guys were offering to us, one of our first ones was through endocrinology. And we just needed a second opinion. That is one of those areas that is hard for our patients to get into at times. And it just varies depending on where they live within the county. So with using eConsults, what we like the most is that they don't have to travel anywhere, that they can truly just, if we ask if they'd like to be referred, we can go ahead and get the referral started directly with you guys, whoever we need, and then we can get those that second opinion if needed, just to kind of help us with our plan of care immediately. We are a nurse practitioner-based clinic, so it's all nurse practitioners within our clinic. There's about 4 of us, and we have a wonderful medical director that does support us, but it's nice to have you guys in our back pocket as well.
That's awesome. That sounds great. And, we know that there's a lot of work ahead of us for the system, for the different practices, and for the different specialists that are participate. So, in current state with what you've done so far, could you just tell us a little bit about the workflow maybe at your clinic and how that's, well, maybe just describe the workflow at first, and then we can go into and you can offer your opinion about what's working and what could be better.
Sure. Again, we're very unique. We're small. We are, patient volume per day is not going to be the same as a more private commercial type practice. So what we do is, as the provider, we really, we have a lot more time with our patients where we can address all of those different factors that go into their care. When we make a plan of care, it definitely has to be patient-centered and attainable. So that's the center of our practice. When we use the eConsult system, we as the providers actually put in the consult. We don't utilize an LPN or a certified medical assistant, none of that. We do it directly. So for us, it's kind of just what we do. It's the way of life and how we see things, as we know that that's our responsibility. It allows us to go in and directly contact that provider, so we can put those information in, the patient demographics, that health history, what is our question at hand, along with the labs and different medications. So we know that the content that's needed to execute, hopefully, an appropriate referral where that provider on the other end knows exactly what we're asking for, we do that. So usually what we do with our, as far as the workflow, if we've got that time before the next patient, we can go ahead and write that while it's fresh in our mind. If not, we'll play catch up, during lunch or maybe at the end of the day, beginning of the next day, we'll go ahead and put it in. What was really surprising is recently, our last one that we put into your system was maybe a week ago, and we had a response within 4 to 5 hours of what we needed. It was really quick. So we greatly appreciated that. Another one we put in very, very fast. You guys are marketing about 48 hours to us, but 4 to 5 was just icing on the cake.
Well, that's to the specialist, I should say, for sure, being available, and that's great, and it being efficient. That's great that that you're putting them in. System in its current state, and a lot of folks who watch it may not know, but it's not integrated with your systems that you may have here. You're having to go into another system. How's that been for you so far?
It is. We utilize a lot of different systems. We use a charting system called IMS, which is not very popular or well known. So we're used to going into different services, just like having to open up a new tab to go ahead and do your telehealth visit. It's just the same thing. We've just incorporated it and embraced it into part of the care, so we can keep that tab up and running. During the day, if we do need it, we have it there. The access of it's very simple. It's not embedded within our EMR. So we just go in and type it. I find it very user-friendly. I'm comfortable with it to submit that eConsult, and then you actually get an email, or we have it set up to go to all of us as the providers and the administrator in the clinic when we have a response coming back from that provider. So all of us as nurse practitioners are notified when someone has replied to us. We alternate our patients. We don't keep the same patient load. So I may see Sally 1 week, and next week another NP will see her. So that way we know what that response was. We can all address it when it comes in. So that's nice. You simply just open up the email, click the link, log in with username and password, hit I think it's the notes tab possibly, and it's right there, written directly from the provider. And then if you have another question, you can go right back to them and get a little bit more clarification if you're not quite understanding what that plan may be.
Very cool. That's great. Can you think of any other barriers we should be looking at, or things that are keeping from it being used more?
No, I wouldn't say that there's anything there that stops us from wanting to use it. We really enjoy the partnership that we have because it's free for us with our clinic right now. I don't know how long that will last, but anything is beneficial when we go to a financial assistance program for a specialty and they have an $80 copay, or maybe it's $50, where this is free right now. Even if it was less than the $50 or the $80, it's still very beneficial. I think the only thing that I would love to see is just more specialists kind of buy into it. I know there's a lot of things to consider when that happens, but we are looking forward to seeing more of those there. One that I do enjoy is neurology. That is a hot commodity where we are. There's not a neurologist in our county. You have to go outside of the county. And so having that there to ask them for help or to give a plan of care is very helpful in regards to finances and logistics for our patients. So yeah, just opening up more of a menu of services providers for the specialists would be wonderful. That's what we would like to see.
Maybe off the top of your head, is there one or two that you would on the wish list that you don't already have available?
As far as eConsults, I'd love to see some cardiology and pulmonology. I'm not sure how much they could actually join to assist, just provide some extra benefit. I know in cardiology we need a lot more, but those are places where the patients are having to travel, and that's a big barrier for ours.
Great, thank you. And I guess just to stay on that stream of thought for a second, there's a lot of efforts to get more mental health, behavioral health out, and I'm sure that's a big need for you. In this case, it would just be asking those questions, medication management, advice, and those kind of things. I'm a general pediatrician, so I think that's where I would use it, and that's one that we've been looking at real closely to get sooner rather than later. What do you think about that?
I think that would be very helpful. We are creative in how we provide mental health to our patients. We have the mental health provided by the state, of course, but they've been gracious to allow us a counselor to come in and see our patients. That's only counseling, no medication management. So they would still need to be able to access that provider there at the mental health department. So yes, anything with psych services would be super. And you mentioned peds. I think when we run school-based health centers with our program, we are not their medical home. We're simply just more of an acute and episodic kind of troubleshooting school-based health center design. So I would love to be able to get, in with the pediatrician, but that's not needed for what we do. We simply just send those kids back over to their pediatrician after they see us with, a written plan of care saying what we did so that they can stay in with their pediatrician. But yeah, that would be very wonderful to see that as well. We just don't see kids in our practice. Typically, I say that in primary care, we do not see children, usually 16 and above, but most of the time, young folks may have Medicaid when they're in our patient population. So adults and older would be our general population.
Well, thanks again. I have one more sort of operational question, and then we'll get into maybe just some thoughts on the context of the response, and then lastly, maybe we'll touch on some of the finance stuff. So you're almost through. So the just operationally speaking, you mentioned I covered a lot of this and saying it's working for you on there. If it did show up in the electronic medical record you're using, or if it was a text-based response, is there any other thing there, or is the email and really going into that simple cloud space the way you like it? Because sometimes people like it that way, just keep it clean there. Or is there some other place that you would like to see it show up?
Well, I think ideally it would be great to have it automatically somehow connected into the EMR. We have 2 different referral tabs built within IMS, our electronic health record system. I guess it could be built in. We also try to pull in some, we partner with MUSC too, so they let us log in with the Epic system, which can sometimes pull over into our system as well. One-stop shop is always ideal. Lets you click the button and access those things and get those records. I think it's potentially possible. I think that would be, may increase, providers wanting to use the service. Anytime there's ease of access for anything, it's all about productivity and time management. I think that would be beneficial if it could go that direction, but I don't want to discourage providers because it's truly just a click. You see it in your email inbox, go ahead and click on, it says click here, open it up, username, password, select your patient, look at those responses. It's not, it's very user friendly.
Okay, great. Well, thank you for that. Let's talk about some of the actual advice from what you've gotten. Is there maybe just touch on the things that were particularly helpful, and if there's anything that, again, for those specialist providers out there, like what kind of context came back and what's been great for you to see?
I think what I've enjoyed the most is that they understand our patient population. We let it out basically in the demographic portion when we're sending over an eConsult that, hey, we're uninsured, very limited. We write for generic medications most of the time. Farm reps don't want to come visit us. We don't benefit them at all. So when they make suggestions, simply last week there was one about wanting to get off of a brand, a particular medication, and switch over to another brand, although it was not on the WellVista program, which is a program that we use for non-insured patients, where they get medications for free to their home. And so the provider that wrote us back was very open to understanding why we couldn't switch over, but we gave those details of different reactions to prior medications that we had tried. We built that case to say, hey, this is why we're asking, a very peculiar case. And it was basically, risk versus benefit on, do we continue this drug or should we consider something else? And if we do, we really have to think about cost if this is even an option for the patient. So that's been super helpful. Even with other eConsults, that's just the freshest in my mind within the last week. They're very good as far as understanding that. And we've done a lot of endocrinology has really been our friend with you guys right now.
That's great. Well, thank you. And you're sounds like from before you're comfortable with that follow-up response and continuing to build that relationship in that case with that provider.
It is, it's great. And sometimes we have patients that may go to a specialist and then they may not have a good experience for one reason or the other. So it's nice to say, well, if you're not wanting to continue there, we may have one other option. where we can go ahead and build up a little bit there. It is different because the patient's not interacting directly with that provider. It's us serving as the middleman there. But I think it does build some trust, and I enjoy that direct contact between, the provider to provider.
And do you feel more, I guess, as empowered is the word, to manage a little further, or they're maybe have less referrals, or just, able to keep them in the medical home a little longer?
It helps a lot. One thing is with us, when patients are seeing specialists outside of the MUSC network, we're having to request those records. And most of the time they're sent over by fax. So you've got to wait on those requests to be sent. Then you've got to take your time and read all 80 pages of whatever that is. With these referrals, it's right there at your fingertips. We just have to then lift that information and embed it within our charting system to house it there. Or we can, fax and scan it in, but that is a big benefit. It almost makes it instantaneous for us when we're doing those.
Okay, thank you. Well, when you're working in a free clinic environment, some of these next questions aren't as relevant, but I've kind of found that you all and the folks working in those environments really have to get savvy, and they really have to work with the patients about maximizing access to all the resources. So I'll go ahead and ask them, and feel free to respond in any way. So as we do move forward, and assuming that these are going to become more commonplace like they are in other places, and we face these barriers, with insurance maybe being turned on, sometimes that's less fortunate for these patients because they were using other resources. Maybe give some context about the pros and cons of billing and the financial aspects of it that you foresee. I think I'll tee it up by saying the one good thing about it, if there was sort of an out-of-pocket payment on these kind of things, they would be less than, a real visit, if you will, or a synchronous visit. I think the going sort of Medicaid, the Medicare rates would sort of be a little less than $40 or something like that. But again, any cost is a lot when it's out of pocket. So any context about, what you see in the future, the impact of being able to bill or finances related to this?
Right, and I think with us, you definitely hit that in the right areas, that we don't bill. We do participate in Best Chance Network. There's some places where we generate revenue from actually billing. But with us, the most important part for us is, again, making sure that it's financially attainable for the patient to, if you charge, let's say $25 for this eConsult, yes, it's cheaper than an $80 copay at a specialty area. So that is a benefit, and $25 is much more attainable for these patients than $80 or $150. So even if it did move into, needing to generate revenue and it was a cost generated kind of program, I still think that our particular style of clinic would benefit greatly to still having this and incorporating it. And I do agree, I think eConsults are going to completely blow up and extend to allow for those rural areas to gain the access that they need. There's a lot, especially in the state where we live, there's a lot of counties without particular specialty areas, and they have the same struggles as who we serve in our county of Kershaw. So we are different with the billing. I do think that we would still want to participate even if there was a charge, incurred. That's something, Medicare, Medicaid, all having a particular, billing structure, whatever that looks like. I think it would need to be equitable and attainable. Everybody's on a budget, whether you're a retiree and your premiums go up for your insurance, you're still on a fixed budget, might be larger than others or smaller. So I think that's just something to consider as you guys may price out what your visits look like. Some specialties, I'm curious if some would, charge more than others. That's an interesting, thing to think about too.
Yeah, I think the good thing is there are established Medicare rates for this. And again, this what we're trying to develop is through the Telehealth Alliance. And so all other specialties across the state could participate in the platform. And I think from wherever entity they're in, and so everyone may have that different approach, right? Whatever they think. But I think the hope would be that it would be at least based around those Medicare rates. And then again, if there's other areas that you bill and those kind of things, I will put in a plug for us primary care folks, and also ask you the question, because it's around, and it's your last one, around productivity, in terms of that, if this was getting billed in via Medicare, then, the preferring provider in this case can drop a bill as well. And, you get a portion of that fee, or you get that fee that you could place on there. Do you think that would make a difference for in your setting? I know you all do a lot of your work out of the goodness of your heart, but maybe there will be less folks that will do that. And in terms of taking time out of your day and clinical productivity, any comments on that?
I think for us, we're going to do it no matter what, whether we can bill a certain code or not. We actually put in, codes or 99204s or whatever we want. We still bill. We just don't actually have any of that, the money portion coming in, because we do want to show what our productivity is, how much revenue we could have generated for the year. That kind of helps our stakeholders understand what we're doing and how well we're doing it. But I would think that, if we were, billing and taking in cash flows, that would be a bonus if we're going to go ahead and get to be able to dip into the pot. As far as once we get that response back or submit that eConsult, I think that plays well into the productivity. I would be apt to doing that more if that helped generate, more for RVUs and things like that as well.
Right. Hopefully that should be the near future state, but we want to be careful about, maintaining this access for your free clinics as well. So we'll
Sure.
keep that dance going forward. Well, any last thoughts or comments? We really appreciate your thoughtful response.
No, I would just encourage providers, if you haven't done this before, to at least give it a try. I think you'll be pleasantly surprised. It's just the visibility piece is very important, so that the clients understand that you're talking directly to the provider. I'm not sure how, if they can't see that is beneficial. It's great to go ahead and have the responses. Again, as the program builds, I'm sure your responses won't be quite as quick. That's just natural with the workflow. But it's just been a wonderful experience, and we're just really appreciative of being able to do this with you guys.
Well, you're an awesome ambassador. Thank you so much.
All right, thank you.
Thanks.